All right. My name is Camille Georgis. I'm with Conversation Orthopedics. I'm joined by Dr. Hassan Mir. He's a professor of orthopedic surgery and medical education. He's also the director of orthopedic trauma research at USF, Florida Orthopaedic Institute. Dr. Mir, the floor is yours.
Yeah, thanks for having me. I appreciate it.
All right, well, let's get started. You hold both an MD and an MBA and previously served as the Chief Financial Officer of the Orthopedic Trauma Association. How has formal business training shaped the way you approach clinical leadership and research?
So I think that uh, having an MBA teaches you to think in terms of the entire system rather than isolated problems. When we take care of patients, we're often presented with individual situations, and you have to focus on the individual patient. But when you're in a leadership role, you have to think about how your decisions affect the entire organization, the people, and then ultimately patient care beyond just the individual patient. So I think that whether I'm leading a research program or managing a clinical service or leading an academic program, I think that really a lot of the principles are the same and learned that through obtaining an MBA. It's that, you want to focus on trying to improve quality, measuring what you're doing, measuring, and that way you can show that you're being successful. And you want to be a good steward of resources. And, that often means managing a budget. And that doesn't necessarily mean, cutting costs, but it means investing wisely in things that actually improve the environment for your team and improve patient care.
And as Director of Orthopedic Trauma Research at USF and the Florida Orthopaedic Institute, what do you see as the most pressing unanswered question in orthopedic trauma today?
So we still have challenges with improving outcomes for all of our patients, right? You can have two patients come in with a very similar injury who you treat in a similar fashion surgically, but then they have vastly different outcomes. Um, and so I think that really we need to look beyond just what we do with our surgical techniques, which is often the focus because we love surgery, we love operating. But if you look at the overall picture, in trying to help patients regain function, return to work, and return to life, I think that our research needs to focus more on the overall recovery and well-being of our patients, looking at the full bio-psychosocial model.
Mhm. Okay, okay. And you sit at the intersection of clinical practice, research, and medical education. How do you balance these roles and how do they inform one another?
I'm not really sure that they're separate roles and separate
Mhm.
jobs. I think that as you take care of patients and if you really track your outcomes, that generates research questions. And then if you then analyze your outcomes and publish and present that leads to a research career. And then beyond that, uh, teaching and training medical students, residents, fellows, and then even practicing surgeons forces you to be current and they constantly question you and make sure that you have good solid reasoning for what you're doing clinically as you're passing it on to the next generation.
Okay, thank you. And what advice would you give residents and students who want to build a strong research portfolio in orthopedic trauma early in their career?
Yeah, I think unfortunately that for a lot of students, it's become a bit of an arms race, just trying to get numbers and get more and more publications, trying to get into the field. But really, what becomes more impactful is asking good questions rather than just trying to publish papers. And then really doing your homework on that question, especially with all the AI tools and everything we have now. Trying to do your homework first, see what's already been done on the subject, if anything. And even if something has been looked at before, if you critically analyze the literature and look to see how you can improve upon what has been done before, or sometimes even repeat what has been done before, that's where you truly add value. So I think you want to really plan on the front end before just jumping in the projects. And then I think really it's important for those, who are residents and who are those who are really planning an academic career to think of this as a marathon, not a sprint. You don't build a career in 1 year. You build it over time with sustained effort and persistence. There's a lot of roadblocks along the way that you have to overcome.
Very well said. Very well said. And your CFO experience gives you a financial lens few surgeons have. How should the next generation of orthopedic surgeons think about the business and economics of musculoskeletal care?
I think that really it's important for every practicing orthopedic surgeon to understand the basics of healthcare economics, right? I've taught a lot of courses for and give a lot of lectures for residents and fellows, and even for med students here locally on the basics of orthopedic aspects of financial practice, right? So I think that at a minimum, physicians should understand the environment that we work in and the healthcare system, no matter what setting you're in, no matter what practice setting it is, you have to understand what pays for the mission, right? The old saying is no margin, no mission. So if you don't understand how the institution is funded, and then, on the personal level, how you're paid, then you're really doing yourself and your practice a disservice.
Mhm. Artificial intelligence is rapidly entering orthopedic trauma, from imaging analysis to fracture classification and outcome prediction. Where do you see the most promise, and where do you remain cautious?
Yeah, I mean, AI is rapidly evolving in every aspect of our of medicine, right? Whether it's around the surgical care of patients, working them up preoperatively, to in the operating room itself, helping us with safer, more precise surgery, to then post-operatively helping improve their outcomes with algorithms and apps and so forth. I think that it's really impacting everything that we do on the patient care side. Then on the research, education, and practice side, there's multiple developments on all of those aspects that are helping us be more efficient and better in every way. I think that I'd caution though that I don't know that it's to the level certainly yet, and I'm not sure that really it should ever fully replace clinical judgment.
Mhm.
Um, and whether that's non-procedural fields or certainly procedural fields, I don't think that AI or robotics are ready to replace us fully. So I really think that we should think of AI as tools that we can utilize to make us better, but not necessarily as our replacements.
Yeah, very well said. Very well said. How do you see the relationship between academic research and industry evolving in orthopedic trauma over the next decade?
So I've been pretty fortunate to have worked in research quite a bit and in academics and education, and then also developed relationships working with industry over the years. And I think that it's really critical to have surgeons working with our industry partners to help develop implants, technology, as was mentioned before, and to help advance the field. I think that really, whether it comes to digital health, data science, AI, all these things require collaboration with industry. But really, the key is to maintain um, integrity and transparency and make sure that you're answering clinical questions in a meaningful way and doing things in a way that are going to improve the field and not just focusing solely on promoting products.
Very well said. What excites you most about the future of orthopedic trauma care and research?
So I think that over time we keep getting better with our data, with our imaging, with biologics, and with AI. And this is going to lead to improvements in patient care and being able to deliver more personalized care to get everyone's outcomes the best that we can. I think also along those lines, the only way we know that we're getting those outcomes the best that we can is by measuring outcomes that actually matter to patients, like getting back to work, recovering, being independent, enjoying their lives. So, while technology is important, I think the real goal is to maximize our patients' outcomes and recoveries, especially after orthopedic trauma.
And finally, what advice would you offer medical students, trainees who hope to become leaders in academic orthopedic surgery?
Um, so I think the first thing is show up. And then when you show up, you want to kind of build a reputation for integrity and reliability. Really, we all I at least hope everybody who goes into orthopedic surgery wants to be an expert clinician, an expert surgeon, right? But if you really want to be a leader in academic orthopedic surgery, you have to develop expertise kind of beyond the operating room. So
Mhm.
whether that's research, leadership, education, business, I think all those things can help you develop your niche within academic medicine, and then showing up, being trustworthy, and being reliable will just lead to more and more opportunities.
All right. Well, thank you, Dr. Hassan Mir, for joining me today in our conversation on orthopedics. All right.
Yeah, thanks for having me. I enjoyed it.